Good afternoon, everyone.
Today's battle rhythm is the Fulfilling a Commitment to Serve, Connecting Veterans to Volunteerism, is hosted by Missy Meyer, the program manager for the Fox Grant with America's Warrior Partnership. That's it for me. I'm going to hand it over to Missy.
Good afternoon, everyone. Thank you for joining us today. I want to welcome everyone to this month's battle rhythm, and thank you, Caitlin, for getting us started today. I want to welcome and introduce our subject matter expert today, Justin McDaniel. And Dr. McDaniel is from Southern Illinois University, and he joins us today as our subject matter expert. And also Matthew PURKEY from Mission Continues, and he is the vice president at Mission Continues, and he's going to be our national resource for today. So if Dr. McDaniel, if you're ready, we'd love to hear what you have to say. We're looking forward to it.
Okay. Well, thank you for having me. I'm really excited to talk to this group today. I've been working with veterans kind of from a research perspective for 6 or 7 years now, and have engaged a couple of different veteran service organizations, particularly around evaluation. And I'm always excited to be able to talk about how that work the research work gets translated into practice. And so that's kind of what the focus of this talk will be today. As you can see on this title slide, I'll be talking a little bit about the work that the Mission Continues and I have done together, specifically in creating an evaluation tool for all the programming that they do. This work has kind of been about a 3-year process. Myself and a few other important people have been involved on the team. Wanted to mention David Albright as a team member. He was a significant contributor in the development of this tool, and he's a professor down in University of Alabama. Heather Pecchios, obviously from Mission Continues, was involved in the writing of the manuscript that I'll talk about later, and also Jenna Rosen, when she was at Mission Continues, had a lot to do with this, and also had a few graduate assistants, Mary, Kyle, and Fanta, who were involved in the work as well. And so we wouldn't be here without all those people coming together on a team. So I just want to talk a little bit about the process that we went through in creating this evaluation tool for Mission Continues programming. Like I said, we started a few years ago, and we just wanted to look at what the best practices were from a scientific, psychological literature standpoint on survey development. And there's a lot of documented work about that, specifically on how you can most accurately draft questions that help you get the information that you want in a highly accurate way, and in a way that can be consistently measured over time. So there's a really specific defined process that we followed, and I'll kind of give you the 30,000-foot view on this slide. In short, we started out with a really thorough review of everything that we could find that had been published on the key programmatic emphasis areas for TMC. And that was personal growth, connectedness, and community impact. And these aren't new concepts. There have been a lot of research on these issues in the past, but TMC was kind of interested in uniquely bringing them together for a specific purpose and a specific population, veterans. And so once we kind of reviewed all the literature, we moved on to conduct one-on-one interviews with veterans and hear more about these 3 areas and what it meant to them in their life. And then we moved on from there to analyze data that we collected in those interviews in order to get some pilot survey questions. And then we reviewed those for clarity, had some veterans review those for clarity. And then we developed the survey in a way that allowed us to actually collect quantitative type evaluation data. We went on from there to refine the survey and then develop a manuscript, which we're trying to get published, and I'll talk more about that later. But let me get a little bit more into the weeds about what we did. like I said, we did a really extensive review of all we could find on this topic. To be exact, our final report manuscript had 101 citations. So we really dug into what other people have said about these topics. And we had three graduate assistants helping out comb through all of those books and papers. And we found that there's a lot of definitions for these three factors that TMC includes in their programming. And oftentimes the definitions vary by population. And so that was important for us to consider. Much of the spirit of these topics were consistent across populations, but there was, to be sure, just slight variations. And there was certainly less information about how these issues applied to military veterans specifically. So our background research led us to do some interviews with military veterans in order to hear from them specifically about what personal growth, what connectedness, what community impact meant to them. And so we drafted 21 open-ended interview questions. And those questions just enabled us to learn more about, like, for example, what connectedness looked like and felt like in the life of a veteran. And so we did these interviews on Zoom. This was pre-pandemic, just to give you some context. And so we'd do these interviews, we'd audio record them, and then we'd create transcripts from the audio recordings, such that the transcript ended up becoming our data source for analysis kind of in this first phase. And so we applied rigorous, like, scientific methods of transcript analysis to these transcripts, and kind of borrowed from the fields of anthropology and sociology and education. And what we would do is just code segments of the transcript to kind of capture the essence of what was being said in those transcripts. And then we would kind of group the codes that we came up with for those segments into these broader themes. And so what we had was these really rich themes that express the voices of veterans around these topics of connectedness and personal growth and community impact. And so it served as like a launching point, essentially, for us to develop what would become the evaluation tool, which would collect quantitative numerical data. For example, in personal growth, a theme was that veterans indicated that personal growth involves learning and skill acquisition in both formal and informal ways. And one veteran specifically said, and this is a quote, "I went to graduate school after leaving service, and the education benefits from service took a lot of the financial barriers away from going to school." And so you can start to see kind of how these themes embody certain quotes from veterans. And so our survey questions that we developed were based basically directly on these themes and quotes from the veterans that we interviewed. So we drafted initially 65 questions across the 3 domains for our evaluation tool. And then we had 3 veterans review those initial survey questions for, like, readability and content clarity. And we made some minor modifications to the wording just to ensure that the way that we were writing those survey questions was consistent with the veteran experience. So here are some example survey questions for the evaluation tool based on the interviews that we did with all the veterans. And these are kind of organized on this slide around the 3 programmatic areas that TMC focuses on: personal growth, connectedness, and community impact. And Mission Continues has this really unique kind of conception of what personal growth is, and the veterans inside Mission Continues kind of express that as well and bear that out, in that part of it, but not all of it, has to do with not only acquiring new skills, but it's about figuring out how to become selfless and building bridges among people. And so you can see kind of like in the example item there, I can think of others before myself. veterans that we interviewed were saying that part of their personal growth was being able to grow in becoming selfless, essentially, and thinking of others before themselves, and thinking and weighing the opinions of other people, and so on and so forth. So there's connectedness, and you can see an example item there is that someone would agree or not agree with the statement, "I'm building camaraderie with other people." Right, and so I won't go through all the items there for the sake of time, but I just wanted to show you kind of a representative sample of the survey questions that we provided in the evaluation tool here. So the next step in the process involved doing some quantitative numerical data collection and analysis, borrowed mainly kind of from the field of psychology. We did psychometric analysis, you'd call it, sort of this process of validating surveys that we collected with close-ended questions. Each survey question had 7 response options. So, for each of those items that I showed on the last slide, the response options for a veteran taking the survey would be strongly disagree, somewhat disagree, neutral, and then so on with the agree items. And then we assigned numbers to each one of those response options, so that a strongly disagree would get a 1 and a strongly agree would get a 7. So with the items and the response options, we pooled those all into a Qualtrics online survey platform and sent that out to veterans across the nation. 850 veterans ended up completing the online version of the survey, which we were extremely thankful for, because that was helpful in really getting the variability of experience within the veteran population. So I won't bore you with explaining the exact type of analysis that we did. I'd be happy to maybe talk more about that in the breakout group if someone is interested in that. But the process ended up helping us narrow down the item pool from our initial 65 items to the best performing 35 items. And there were many items that the analysis kind of revealed were not very good. Maybe they were confusing to veterans, didn't quite make sense with their experience, or difficult to understand. So we dropped those items, which is a standard practice in the type of analysis that we did. So the final version of the instrument left us with a rigorous, scientifically validated evaluation tool that, when completed, could yield scores ranging from 35 to 245, where a higher score would indicate essentially higher veteran empowerment. That comes kind of from the title of the instrument. If you saw in the title of the presentation there, we called it the Empowered Veteran Index. So the index ranges from 35 to 245. Higher scores indicate higher empowerment. So there's a lot of things that the mission continues is planning on doing with the Empowered Veteran Index, and I'm involved in some of that work, which I'm very thankful for. First, we're working on the final edits of a journal article, which has been accepted for publication in the Journal of Prevention and Health Promotion, which is fairly well-respected journal in this space. And so we'll be able to point to the fact that this process has gone through the peer review process, such that many academics reviewed this paper, provided comments on it. We addressed those comments and got it to a point where the scientific community felt that it was best to be published and to distribute among the scientific and practice community. So we're excited about that coming out. Secondly, the mission continues plans to use this instrument now to evaluate their programming and determine if veterans are becoming more empowered as a result of being involved in volunteering efforts in their communities. And so this is an excellent way just to get data for quality improvement processes within the organization, and to figure out, like, are we doing good with connectedness? Are we doing good with community impact? Are veterans responding more favorably to certain aspects of our programming than others? All these kind of questions the evaluation tool can address. And then thirdly, we're in the process of developing a shorter version of the EVI, the Empowered Veteran Index. And that would permit more efficient, rapid data collection. Sometimes 35 items can feel like a bit of a time investment. And so if we could whittle the index down to somewhere between 10 to 15 items, I think that might help with survey fatigue and permit more rapid collection of data. So we're working on that, and may have that one out and published perhaps later this year. And so that kind of summarizes very quickly the process that we went through to develop an evaluation tool that fits the specific programmatic elements within the Mission Continues. I hope that was helpful, and looking forward to talking more about it later in the breakout group. Before I turn the mic over, I just wanted also to plug my book that will be coming out in September this year. I have the cover art for that on this slide here. Oxford University Press is publishing this book, which covers a lot of topics that are kind of there in the subtitle: Combat Trauma, Moral Injury, and Psychological Health. And we just kind of wrestle with some of these concepts like moral injury, which the veteran community is very well aware of, but hasn't quite made it into things like the disability rating for veterans, and hasn't quite made it into the DSM for formal diagnosis. And so I look forward to sharing this book widely and having conversation about it, as I think it addresses a lot of important topics among veterans. So I'd be happy to answer questions about that as well later.
Thank you, Dr. McDaniel. That was really interesting. I look forward to your book and to seeing the short form whenever that gets into creation. I know that will be a big help. Like you said, assessment fatigue is definitely a real thing that we're all dealing with. Now I'd like to introduce everyone to our national resource for this month's Battle Rhythm. And we have Matthew PURKEY from Mission Continues. Matthew, thank you so much for being here. We look forward to your presentation as well.
Absolutely. Missy, thank you so much for that introduction. Dr. McDaniel, obviously you and I spoke a lot prior to this meeting, and I'm a huge fan of your work, and I will tell this crowd why here in just a couple minutes. Two housekeeping notes on my end. One, I am on spring break with my children right now, so even though you see a button-up shirt, I do in fact have swimming trunks on, and that also means I'm in a house full of kids. So if there's background noise, I do apologize. Number two, I would like to give a huge shout out to someone very special on this call, the one and only Heather Piquios, our Senior Manager of Research and Evaluation at the Mission Continues. None of the work that we are able to do in the field is possible without her ability to measure if we are succeeding or not. So Heather, thank you for being here. And as always, hold me accountable for my words. Like Missy said, my name is Matthew PURKEY. I have the honor of serving as the Vice President of Operations here at the Mission Continues. What does that mean? That means I'm in charge of all 48 locations of the local service platoon program and our service projects. And I work towards our vision of all veterans with the desire to continue their service will be part of a movement to transform communities. And we will do that by connecting military veterans with opportunities to continue their service and leadership in under-resourced communities. Heather holds me so accountable that even the verbiage in our mission and vision, it changes along the way. In fact, under-resourced has actually been brought to us as a term that is no longer applicable to the communities in which we serve. So all the way down to that level, everything that we do, all the words that we use, it is very intentional. Heather, once again, thank you for that. We are in over 45 cities. That is all across the continental US, and 2 with our brothers and sisters in Puerto Rico. If they were on the call right now, they would still laugh at me in my attempt to say that correctly. But 45 cities across the country, and 150 active community partners. What does that mean? 150 active community partners means that we, the mission continues, we do not have a food bank. We do not have a homeless shelter. We do not have these types of physical locations. We are not the service provider, but we support those that are in those fields. For instance, in the communities in which we serve, and obviously every community has its own very unique identity. Denver, Southern California, New Orleans, we do not go into these communities and say, hey, the mission continues is here to combat X, Y, and Z here. We understand that there is no one that knows the needs of their communities more than those in that community. So in every one of our locations is a very unique mission and skill set that we apply to combating the local need. Once again, we do not give a blanket statement across the country saying we fight childhood illiteracy or we fight food insecurity, things of that nature. That is not our place. We realize that. And one of many things that we do very well is that we listen to the community before we do anything, whether it's meeting with local community members, leadership, whatever that is. We want to hear the vision of that community first before we come in and, God forbid, our helping actually ends up hurting. So we are very in touch with the communities in which we serve. All right, so you heard from Justin a little while about what is the EVI. And in my professional career, Marine Corps veteran, I'm sure someone in the chat right now is trying to type in URA, so I'll just say it for everybody, Ra. Throughout my career, my last deployment was in Haiti post-earthquake 2010. And I had no idea what I wanted to do. And in fact, during that deployment, and you guys all know what I'm talking about, when you're trained to do a very specific thing, and then you put those same individuals in humanitarian assistance, we were not prepared mentally, we were not prepared spiritually, we were not prepared for the things that we would be doing while in Haiti. After that, I actually had a 10-year career with the United Way across the country. I led 3 different United Ways in 3 different states. And when I was deciding on my next career move, when I was looking, the mission continues, I saw this work and it was so applicable to an actual veteran story. So like I said, the individuals that were put in humanitarian assistance after being trained to do not humanitarian assistance, my unit went on to have the highest suicide rate for quite some time. So I've lost 7 brothers to suicide. And if you look at their cases individually, there is nothing that can draw them together. Yes, they were all Marines, but there's Black, white, Hispanic. There are those that were in active addiction. There was those in recovery. There was those that were extremely successful in their careers, single, married, families, no kids, all across the board. But 2 things that I saw through every single one of my brother's eyes when I read the Empowered Veteran Index was that they had 2 things in common. 1, they had lost a higher calling, purpose, or mission in their life that they were passionate about. And 2, they had lost that camaraderie and the connection with the veteran community. When I thought about those 7 brothers and I looked at the Empowered Veteran Index, what I saw immediately was, when applied properly, this research, this tool, this could actually prevent anybody else feeling that night I got those calls from those 7 family members after finding out my brother's making those same decisions or final decisions. And if you talk to Heather, I would hope that she would say, Matthew brings intentionality and passion to this work, because when the EVI is applied, every veteran I get to talk to, I bring that same passion and intentionality in everything we do, as if I'm able to have that conversation right before those same brothers make that decision. So these are not just words on a page. This is not just a theory. This is real life, and it touches every veteran and non-veteran that we have connected to us at the Mission Continues. So personal growth, community impact, and connectedness. We do everything that we do at the Mission Continues is made through this decision-making framework. This is applied to everything we do. How veterans impact drive our approach. So I would like you to focus on the middle pillar. So the service projects focus on the Empowered Veteran Index. Once again, when done correctly, and this is applied to everything we do, we can actually, the veterans are empowered by connection and purpose through community impact. So once again, this is research, this is a technique, this is theory, this is all that work that was done on the back end is now applied to our daily work. And when done correctly, those veterans are empowered by connection and purpose through community impact. So then that's on the veteran side. Those veterans are then given the opportunity to serve in their local communities. And when the service platoon program, which once again, I'm honored to be able to lead, when done correctly, we increase community partners' ability to serve more people, offer more services, and access more resources. We are not the direct provider once again, but when we I'll just use the word deploy the local veterans in that community to do the type of work that is needed, we actually empower the community to become stronger while the Marine or the veterans are connecting. They're growing personally, and we're leaving a lasting impact in those communities. So once again, it's easy to look at PowerPoints and to think, hey, this is great in theory, this is how it works. And I want to say up front, the Mission Continues does not set out, we are not specifically a suicide prevention organization. We have a lot of great partners that are. What we do and what we do very well is give people opportunities to come back and serve. Because and everyone on this call who's a veteran knows this, when you go through something hard, when you go through the suck, you come out stronger because of it, both individually and as a unit. So I'll call her Allison. I was in Atlanta. What was that? I was in Atlanta for Dr. King Day of Service with the local platoon in Atlanta. And there was this female veteran that was off to the side by herself. And she was very skittish. She was very standoffish. She, body language is saying she's closed off, had no intention of connecting. As the day went on, I made it my mission was to, hey, welcome to the Mission Continues. Here's why we serve. And by serving, here's how we improve our quality of life as individuals. Well, come to find out, Allison, this was her 5th service project that she had signed up for. And it was the first time that she ever came out to one. She had not left her house in 2.5 years because of debilitating anxiety and depression. Stemmed from sexual assault in the military. And as she was working alongside others, she started to open up. And when she opened up to me, look, I have no idea what it is to be a female veteran. I have no idea what it is to live in her situation. But because of the connectedness, because of the personal growth that all of our veterans at our job sites have gone through, I had an entire group of female veterans on the spot, willing and ready to just welcome her into this family, welcome her into this project, welcome her into this work. And now Allison is applying for all of our programs. She is one of our most decorated volunteers in Atlanta. And she would say, and Heather hears it all the time also, this organization saved my life. And we don't set out to do so. It is a byproduct of properly applying the EVI to everything we do. Here is how we measure our success according to what Dr. McDaniel had presented. 77% of our veterans have a greater sense of purpose. 80% feel that they have an ability to make a difference in their community. And almost 80% feel more connected to other veterans and sense of community through the Mission Continues. What is measured matters. And this is what we do every day. We set out and we apply the EVI as a not only decision-making framework and lens, but also everything we measure ourselves up against. We are also just not a service organization. There is so much more than just volunteering. Volunteering is the first step, and we all know this on this call, but if we don't have a so what, if we don't have a what's next, we're all looking for that next step. And so here's other ways that veterans can get involved in our work. The Women's Veteran Leadership Program, amazing program. This is one of those things that applications open and we have to close it like an hour later because we are just bombarded with applications. Operation District Drill Down, that is our mass deployment that is coming to our nation's capital, June 21st through 27th. We actually bring in veterans from across the country for a full week of service and leadership development. And once again, with the lens of connectedness, personal growth, and lasting community impact. The Volt, that's our online self-paced leadership training. The Alumni Network, if you're a part of any of our programs and graduated, you are automatically part of our alumni network. And then Leading for All. This is the program. It actually wrapped up this week, yesterday, maybe, Heather. Heather was there. I did not have the opportunity to go to this one, but this is a way to help shape the future of the program, or I'm sorry, help shape the future of an individual's leadership by identifying personal biases, becoming more culturally competent, all of these things that are brought into this program. And that is how the Mission Continues applies the Empowered Veteran Index to the work we do on a daily basis. I'm sorry, that was really fast, a lot of information. I would love to talk more in the breakout sessions. I just know that we were on a time crunch, so I do apologize if I was talking really fast.
Thank you so much, Matthew. That was great. And I'm so glad that Allison was able to connect to you. It's such a moving story. And I know there's, hundreds of thousands of more people who could benefit from exactly what you're describing. So thank you for that. And we have some questions in the chat box. So let me run up those real quick. And let's see what we can get answered before we go into our breakout sessions. Let's see, what has replaced under-resourced as the terminology you mentioned in your presentation? Is that being a kind of an outdated term, Matthew?
So Heather will know a lot more about this than I will. But when we first heard it, so we're doing all of our work in Washington, D.C. in Ward 7 and Ward 8 on the south side of D.C. And you can literally see all of the nation's most powerful buildings in the backdrop. And when we said at a visioning session in front of community leaders, we serve under-resourced communities, and every community has it. It's like the neighborhood matriarch comes and she's like, now, Matthew, I want to tell you something. We're not under-resourced, we're overlooked. And I was like, oh, they're like, the resources are here. But every nonprofit comes into our community, they do what's popular that day or that week or that month, and then they pick up and they leave. We're not under-resourced, we're overlooked.
That's incredible. Thank you. That's actually a really powerful answer. I wasn't expecting that.
I would add to that a little bit because there is a caveat. We do use that still on a high level, right? We have to adapt to our audiences. So I saw some, and I don't want to co-opt the time. So I saw some dialogue in there. The conversation started years ago. We looked to academic research to see how our typically historically excluded communities described. And we saw that term. And we were challenged with that by staff about a year ago, a few months ago. So we said, yeah, we're never going to be an organization that says we say it this way now, so we're going to say it this way forever. We continue to learn, right? So we went back and we looked to the research and we looked to organizations that are doing community development work. And we saw that under-resourced was still, if you're talking to certain audiences, if you have to describe where do we serve, we still do use that. We do adapt to the audiences because we know, I saw somebody put in there, words have meaning, words have power. So that's part of us continually learning. And we're so thankful Matthew shared that with us because it also keeps our team and the organization on our toes to think about how do we describe systemic type of issues thoughtfully, respectfully, and dependent on the situation.
Absolutely. All right. Any other questions or anything?
There was one, Missy, when Dr. McDaniel was talking about the manuscript. Will the manuscript be made available? And will that be before or after your book is available?
I don't have a specific timeline on the manuscript about the EVI. I expect it to be out sometime this summer, and I'm sure Heather will share that through various channels that they have. and I will too. But yeah, nothing specific yet on that one.
Right. And when was your book going to come out again?
September.
September. Okay.
Will A, I see your hand up.
Yeah, thank you. I just wanted to follow up again with Heather. Do you ever see the term underserved in work specifically around veterans and the work that the Mission Continues does, or sort of your other community development and public health, experience and training?
We have seen underserved, and we made an intentional choice to not use it in our terminology when it comes to, we have a community impact framework as well, and it's rooted in an asset-based community development approach. So we're always committed to, like Matthew said, they had this visioning session. What they did for a mass deployment is they went and they met with community members, community leaders, and said, tell us about your community. Nobody better can. Tell us what's working there. Tell us what your goals are. Tell us what you identified as your needs, and we can let you know where we can help you reach some of your goals quicker. And so we've used, giving you a little bit of background on that, we used under-resourced versus underserved, because it was really important for us, for our population who comes to us to serve with us, and where we're seeking to build bridges and help folks, the civilians and veterans, gain a sense of empathy for each other and their backgrounds, that we wanted to make sure that when we're talking with our veterans, our committed volunteers, to say, it's not about saying underserved can communicate that people need us, that they're not going to be able to do anything without us, versus we're getting to work alongside them to help them reach their goals. And under-resourced communicates more of a systemic type of issue, and helped us clarify messaging with the veterans in our network.
Well, that sounds great, and I appreciate all the extra context. Thank you.
Thank you. I put this is stuff I love to talk about and love to learn about. I said, we're not static in our language. We do come back to it. So please reach out.
Thanks so much, Heather. And thank you again to Matthew and Justin for their wonderful presentation. Caitlin, you want to lead us into the breakout room?
Sure. So for the next 25 minutes, we'll go into breakout groups. I'm glad this conversation has already started. We're going to continue it in the breakout rooms. I have broadcasted the breakout room, so you should be able to go ahead and pick a room. If you can't see it, this is my biggest fear, because I tried to make sure that didn't happen to me again. But I can start shuffling people into rooms. So it should be at the bottom, and then you should be able to search. Can y'all see the breakouts? No. Okay.
Yes, I can see them on my end.
Oh, you can see them. Okay, good.
I see people moving in, so I think we're heading in the right direction.
Okay. So the breakout topics, room 1 is evaluation, room 2 is benefits of volunteering, and room 3 is motivating veterans. Hello, welcome back. I hope we had some great discussion in the breakout rooms. We're going to go ahead and just do a round robin of the discussions. So if someone from the first group, the evaluation group, wanted to share out just kind of an overview of the discussion that was had, that would be great. What was in number 1?
I could give a quick summary. I wasn't there for the whole time. I kind of jumped in to catch a little bit of what another group was saying, but I think it was Dr. McDaniel and then myself and 2 others. And I'm looking for them now. I think people are still kind of filtering back in. So hopefully if I leave anything out, they'll feel empowered to add it. I think it was Tara and Gabriel who just joined now, myself and Dr. McDaniel, and we were talking about evaluation. He certainly has a pretty high level academic grasp of those sorts of things. And I had shared that some of the groups that I work with could maybe benefit from a more explicit understanding of their mission, and then operationalizing some evaluation practices in like their day-to-day operation engagement. But I see that now that the rest of that group has joined us, so I'd invite them to share.
Yeah, so evaluation group, does anybody else want to add to the summary of the discussion?
I think Will captured what we were talking about. It really is just challenging sometimes when you're so busy trying to serve people in your community, to think ahead about the types of data collection tools that you'd use to measure your programming. That phenomenon is documented well. You just get so busy with your mission that you don't have time to think about, what instruments you could find or create to collect data to see if you're making the impact that you intend to make. I guess the benefit, I guess, of what the Mission Continues has done is that they've kind of outsourced that work to an academic and whose expertise is to do that sort of thing. And so that's one strategy, I guess, to overcome that problem.
Yeah, for sure. I mean, sometimes we think about evaluation as a luxury, even though it should be more like brushing your teeth and eating healthy. But that's a great point. Okay, so topic 2, benefits of volunteering. If somebody wants to share out, I forgot to tell the leaders to volunteer somebody to be the presenter, but Matthew, did you have anybody that you would want to recommend do the summary?
Abby, would you be up for it? Abby's like, don't pick me. Just because we're from the same state, don't pick me.
Can do it. That's totally fine.
Yes.
Although I'm never telling anybody where I live again, so they don't volunteer me for this. Okay, so the 3 things that we really kind of took away from ours was intentionality with opportunities, whether leading or participating really matters, whether it's where your organization spends dollars for say you're providing a meal. Matthew brought up that the Mission Continues is really intentional with where they spend their money, and food doesn't come from chains, it comes from locally owned and operated stores. And then we also were talking about how the opportunities that our organizations are bringing to the community is a really good chance for military culture exposure, and hoping to organically, bring everybody together. And, the intention is not to alienate one population from another, but creating sort of a new environment where people can learn from each other and, expand volunteerism throughout their communities. And then the last thing that we talked when the message popped up saying that we had to stop talking was that a variety of volunteer opportunities matters. I think it was Danielle in our group brought up kind of her organization, what you see in Texas is not what you're going to see in Boston. And so, while it's good to cater to those specific populations, it's also, oh no, Caitlin, you took my notes away when you made it full screen.
Oh, I'm sorry.
It's okay. But it was kind of like, catering to specific populations, but also is there a possibility for standardization across the board so that you know what to expect? Because say like I leave Matthew all alone in Indiana and I go somewhere else, I would like to know that if I go to another Mission Continues deployment, that I know exactly what's going to happen when I get there. So kind of, catering to those populations, but also making sure that experiences are, and procedures, I guess is a better way to say it, procedures are relatively the same.
Perfect. And then the third group, motivating veterans to engage in community. I think it was kind of an ad hoc group. So is there somebody that wants to volunteer to talk about the summary?
I took the notes, so they're letting me share with the request of if I missed anything, please jump in. What a group. I joined this because I have areas to learn in all of the topics, but this one in particular, I mean, we could see like Matthew, I learned so much from him and his team. And it's not what I get to do in my day-to-day. So we saw even in info sharing across organizations, sort of even from Matthew and me earlier, certain times where we use certain language and not because the way it translates, right? Like neither are wrong, both are right in different contexts. So hearing how does engagement translate across different folks who are engaging with volunteers? So several people shared, and we have first Heather from Travis Manion Foundation. She talked about the importance of the low barrier to volunteerism, and an example of that, her and her crew, who is Josh, also is from Travis Manion Foundation on the call. They said one of the things, or she said one of the things they'll do is when they get a volunteer in, they'll get them involved doing something that is kind of meets them where they are in their confidence level of coming on, build their confidence and help them to see, step into more and more roles of leadership within their scope of work. Heather, if I missed anything, please don't, I did. Oh, we're good. Okay. We have John Rice. Sorry, John, if I missed that, from Cuyahoga County, Cleveland. And hopefully I pronounced that right. If I didn't, check me on that. Don't over recruit volunteers. They know there's a certain percentage of a no-show rate. They've done a lot in their county and in their community, and they have a variety of ways that volunteers can engage. They started from a place of being like, if you don't, they know they shouldn't over recruit. They had to start with making up kind of a baseline. Hey, we think it's about 25%, for example, and then worked from there to refine it. And that's ongoing work, right? Pre-COVID, COVID, post-COVID kind of thing. Jennifer Adamson from Psych Armor said the power of storytelling, how contagious it is. So she was giving an example of, sometimes it is going to be inevitable that people are going to be standing around, have too much to do. We can dig into their stories, find ways for them to share about why they love what they're doing, how they can, I'm Jennifer, if you might have said this, I might be making it up, but like maybe they do like social posts, they go live or something on it, right? Some way that they're still connected to that day and sharing why it's meaningful to them in a way that's going to connect with others, and also asking them afterward how they'd invite others in so we can know how to broaden our scope. And Bernie Tyler from the Janine Partnership shared a really great example of how we can partner, remembering that the veterans, they engage because they love to serve and they want to engage, and how one of the things she's doing right now, it's with Wounded Warrior Project. But Bernie, it sounded to me like this is something you can do whenever it works for your schedule. Her and her dog, they're getting some miles in this month, and in partnership with Wounded Warrior Partnership, so they're still connected to WWP, but they're able to do that. She's able to do that on her own time with her dog. And if I missed anything, folks, please jump in, or if I misspoke on anything.
No, I think that is great. I appreciate everybody for participating in those discussions, and I'm going to go ahead and hand it over to Missy for closing. Thank you.
Thanks, Caitlin. And thank you all for being here. Thank you so much to Matthew and Justin, and to Will Atkinson for facilitating our third group. We really appreciate y'all all participating in our battle rhythm today. Thank you for collaborating and sharing. At America's Warrior Partnership, we partner with communities to improve veterans' quality of life and thereby reduce veterans' death by suicide or self-harm. We believe communities are best equipped to improve the quality of life for veterans. Our goal at America's Warrior Partnership, and our goal today, is to provide community partners like yourself with support, information, and best practice to help you deliver quality services to the veterans in your community. The next battle rhythm is here on May 1st. It's going to be focused on the PACT Act. We're excited to have a representative from the U.S. Department of Veterans Affairs as our subject matter expert. We hope you can attend. Thank you, and have a great rest of your day. Thank you all for coming. Bye, guys.
Yes, thank you. Enjoy your spring break if anybody's on spring break.
Bye.
Bye. Thank you, guys. Have a good one.
Thanks,
Good day.
everybody.